So I'm just going to go through our list, and you can chime in and say if there's other people with you listening in as well. So it looks like Jessica Brown.
Yes, I'm here.
Anyone? And you're from which clinic?
Providence Spokane Valley Family Medicine.
Great, thank you.
Mm-hmm.
And Carlene?
Yes, I'm here.
Hi, Carlene. And
Hi.
you're from Associated Family Physicians?
Correct.
Great. And Hope, are you there? Can you hear us?
Hi, this is Joellen from Spokane.
Hi, Joellen.
Hi.
And we have Hope from Dr. Condon's office. I'm not sure she can talk, though. And then we have Heather. Are you on?
Yes.
Great. Thanks, Heather, from Roth Family Medicine. And Julie?
Yep, this is Julie from Providence Family Medicine.
Hi, Julie.
Hi.
And Dwayne?
Yes, hi, from Sacred Heart and Holy Family.
Hi there.
Hello.
And then we have Michelle. Can you let us know what clinic you're from? Maybe she can't hear. She might be viewing without sound. And then we have Patty.
Hi, Danette. I'm here. I'm from Spokane Regional Health District.
Thanks, Patty.
Mm-hmm.
And Sari, are you there? Can you hear us?
Yes, from Spokane Falls Family Clinic.
Great. Thanks for joining us. Did I miss anybody? Is there anyone else listening?
I believe Randy Shell from Providence is trying to get on right now as well.
Okay. Thanks. All right. So today, Michelle from Heart Family Medicine. Thanks for typing that in, Michelle. So today we have Rhonda Hurst from Scientific Technologies Corporation going over our online reporting, monthly reporting training. So there's a bit of changes happening with our monthly reporting system, and we're kind of in the transition phases right now. You probably have heard about it or possibly even attended one of DOH's online training sessions as well. So we wanted to get everybody together for our lunch and learn and talk about it again. And if you have any questions, please feel free to ask. That's what this hour is set aside for. But for now, I'm going to turn it over to Rhonda Hurst.
Hello, everybody. This is Rhonda Hurst. So yes, today we'll be just reviewing the online inventory reporting. So as Danette mentioned, we are all moving towards away from the paper-based reporting system. We're trying as a state to go more paperless and to be more conscious. And also this helps to streamline it for everybody so that the information is readily available in the system for any style of user that wants to see it and has a need to see that information. So it really helps everybody in the long run. So this is the purpose for today's training. It's going to mirror, I'm not sure if many of you have gone to, just the state of Washington has done some training also on the online inventory reporting. This will mirror that, so it will be very close for those who have gone to those trainings. There are just a few differences with today, but they're pretty subtle. So, and for those of you who have not been able to go to one of those trainings, this will definitely be beneficial to you. But we will try to aim it a little more towards Spokane in particular. So this will be the monthly inventory workflow. And I suppose I probably should just confirm that you guys can hear me, right? I haven't heard anybody say, Rhonda, we can't hear you. So.
Yeah, we can hear you.
Okay, perfect. And you can see my screen okay as well, the PowerPoint with the workflow.
Well, this is Joellen at Group Health, and we can see it.
Great. Okay. I will assume that that is true for everybody then, unless you tell me otherwise. So this is the workflow for your monthly inventory reporting. So you will always want to start with cleaning up this little star over here. So cleanup is a very essential part, and that is for starting out. So if there is anybody on the call who is not currently managing your inventory in the immunization system, maybe you have an interface and you've been doing more paper-based reporting, or you have a lot of expired lots in your inventory, or you just haven't really been managing it through the immunization system, the first thing that you will want to do is to clean that up. And we'll go over a couple of steps of how to do that in just a minute. So this is number one, and then it leads right on into the normal workflow. So the cleanup is just kind of a one-time deal, but it is very important. And then throughout the month, you'll want to do this workflow, which is troubleshooting, just as you've normally been doing, depending on the way that your information is coming into the system. So just do your normal troubleshooting throughout the month, and then do your count, just as you normally do. And then the two differences here will be the doses administered report and the inventory submission report. So the doses administered report is the one that breaks down the information by age range for the patients that have been given vaccines by lot number. And then also the inventory submission report, it will be turned in from the reconciliation page, but it is the same as the lot number summary report that you all are used to. So these are the two reports that we'll be going over today, and then after that you will be able to order, do your monthly orders, and then circles back around, back to troubleshooting throughout the month, and then so it's all just a big cycle and repeats itself every month. And of course, for those of you that don't order every month, then that would be whatever your appropriate time is for ordering is when you would order. So as I mentioned before, the initial cleanup, it's not part of the monthly workflow, but it is important to do this before you jump right into the online reporting. So what you'll want to do for cleaning up is you'll want to prepare, so have a count ready of your refrigerator, and then actually go in and clean that up. So go to the reconciliation page, inactivate anything that is not currently in your fridge. That includes expired ones, anything that you've transferred out, anything that has been used that somehow didn't make it into the system or wasn't matched to a patient, or whatever the case may be. If you haven't looked at your inventory for a while, it might be kind of a mess. So it's really, really crucial that you get in there before you start doing your monthly reporting online and just get that cleaned up. So if you start with a fresh, clean slate, it's much easier to find any deviations from that and anything that did not match up as you go forward. So you'll want to start out nice and clean. So inactivate anything that's no longer in there. Reconcile your inventory. So go in and just type in exactly what you do have in your fridge at that time, and then add anything that's not already in the system. So once you've done that, the reconciliation page should match what is in your fridge. And then moving forward, if you are not already, I imagine most of you probably are, but if there is anybody out there who is not currently receiving your orders through the system, you'll want to do that moving forward. And also just be sure, if you are receiving your orders, do it before any of them are used. Because especially now since we're moving towards everything being online, if the computer doesn't know that those doses are available to be used, it can't match them up to anything whenever you send us, hey, this patient got this lot number. If that lot number is not in the system, it can't match it to anything. So you need to tell the system, yes, I got this, and go in and just receive those orders as they come in. So as far as, so this is just part of the cleanup. So as far as inactivating, reconciling, and adding, you would do this through the reconciliation page. So you can print it off here, take that worksheet to your refrigerator, get a count, and then type in your physical inventory here. If you need to inactivate anything, then you can just click on this. You'll need to zero it out first. Just confirm that, oops, sorry. Inactivate it here. Just check this box and it will take it off of this page as long as there's 0. And then you can just save. If you do need to add any lot numbers that are not already on this page, then you can do that through the search add page. So that is the reconciliation part. And again, that is just for the initial cleanup in case your inventory has gotten away from you and you haven't really been tracking that month by month. This is the first step for you. And then moving forward, of course, receive those orders as they come in, as soon as they come in, if you can. So just all you do for that is you go to the current this is the same place where you place your orders. You just go in, select the order line. So we got this one today. It came into our office. You select it, and you just type in the number that you received there. And then you click Receive, and it should populate on your reconciliation page after you do that. So I'm just going to pause right here. I think that most of you guys are pretty familiar with all of this, but I will just pause right here for questions. Would anybody like me to demonstrate this in the system, or are you a little unfamiliar with any of these steps, or should I go ahead and move on? Okay, so I'm not hearing anything and no cries for help, so I'll just double check the chat box. Okay, I'll just assume that everybody has this down. I think Spokane usually tends to be ahead of the curve in that way, so sounds good. We'll go ahead and move on. So again, don't forget to do that initial cleanup before you start your monthly reporting if you have not already. So as far as the actual monthly reporting, as I mentioned, this is the workflow that we'll be using. You'll want to begin with troubleshooting just as you normally are. I'm not going to go too much into that. We have had lunch and learns on just troubleshooting for your style of clinic, depending on how you give information to the system, whether it's manual entry or HL7 interface and so on. I'm not going to go into too much detail here, but if you would like more information, please contact Danette or I, and we can definitely help you. But we'll start off with count. So in order to do your count, as we just mentioned before, you'll just want to go to the reconciliation page and click Print, and this will give you a handy-dandy worksheet that you can take with you to your refrigerator, and then just put in your physical inventory here. So ideally, you would want these numbers to match, right? Your physical inventory, you would want to match what the system says that you have. So you can go in, do your count, and then the very first report that you'll want to do, and this is, we're just going to say everybody should do it in this order. So after you've done your count, the first report that you'll want to do is a vaccine administered report. So you'll come in here, and it is, I'll show you where it is in the system actually. The vaccine administered report is, it's just a doses administered report right here, just above the reconciliation page. So here's the reconciliation page, and just above that is the doses administered report. Sometimes it's called the vaccine administered, sometimes it's the doses administered. It's the same thing, just two different names. So you'll fill out this report, fill out the information. This might already be auto-populated for you. Just change it if anything needs to be changed. But you'll need to put your name, phone number, and email address so that the Spokane LHJ can get a hold of you just in case. And also type in the date range. So I like to do the reporting month first. So you'll choose the month for which the reporting period begins. So for this example, it's June, and so we'll put in the dates for the 1st through 30th. If you happen to be a mid-month reporter, so you're turning in your reports on the 15th instead of the 30th, then you'll want to do whichever month your reporting period begins with. So if it was, for example, June 15th to July 14th, or June 16th through the 15th, you would want to use June as your reporting month. So use whichever the reporting month begins with, that month it begins with. And this will auto-fill these. If you've already turned in some of your reports online, then it should auto-populate the from date, because it will just automatically go to the very next day. So if I had already done through the 30th and I was to come back, then it would automatically pre-populate with July 1st here, because that's the very next day after the last day that I reported. So it's pretty nice, and it prevents you from having any gaps or overlaps in the days that you're reporting for. So what to do if the wrong month is selected? I will just spend a moment on that. So the report, you cannot go any less than 15 days between reporting periods, and no more than 45 days. So if you do happen to get off a month, or if you choose the wrong month or put in the wrong wrong date range and you just need to get back on track, then what you'll want to do is, you can go down to 15 days or up to 45 days and just keep doing that to catch yourself back up. Does that make sense to everybody? So if you did it too early, so if you did it for June 15th, and then you meant to do it for July, then you would want to shorten it to next time. I'm having to do math in my head here, I'm sorry. Anyway, so just use the date range that'll catch you back up, and you can use a couple of months to get you back on track for the correct month. So no less than 15 days, no more than 45 days.
Oh, I'm in there.
Does anybody have any questions on that?
No.
This is Julie from Providence Family Medicine Residency. I had a question.
Mm-hmm.
I like to use this report mid-month just to double check and see how things are going. Does it mess things up if I use it just for myself, or is it actually submitting a report?
No, it does not submit unless you actually say submit. So you can come in and check it. Just make sure that you don't actually click submit the report. So yeah, you can come in here anytime throughout the month and just look at your numbers if you'd like. Let's see, the next page here, just don't click submit. That's all. Just click cancel whenever you get out, and it should be fine.
Okay, thank you.
Mm-hmm. So this is what the report will look like once you have run it. It will have each of your vaccines broken down by lot number, and it will have each of the lot numbers listed here if you have several per vaccine. And then it has the age range that you've administered it for. So it should have all of the numbers listed here based on the information that we're getting into the system. And then if everything looks good on here, assuming that you've been doing your troubleshooting throughout the month and you've been finding any typos or errors or wrong lot selections, ideally if you've been doing that throughout the month and your counts match that reconciliation page that you printed, then this report should be right on. If it's not, then I would just do one more round of the troubleshooting, just make sure that everything came over properly. But it should be pretty close, if not spot on. And then you can just click submit. But again, until you click submit, this does not go anywhere. It just stays in your hands until you click submit. So there's no harm in running this as you go throughout the month. And you can print this off. One way you can export it to an Excel file. And also, if you just use the print feature in your browser, usually it's like right-click and print, then that will print it as well. So that is it for the doses administered report. It's fairly simple. All you do is just type in the information, double check that it's correct, and press submit. And once you've done this, then it sends it off, and Dearest Annette can see it. So then the next report that you will be responsible for is the inventory submission report. And again, this is a reflection of the lot number summary report. It's virtually the same. You're just filling it out a little differently. So it's run off of the reconciliation page. And so you just get there the normal way from reconciliation under lot numbers. So then this is where you use that count that you took of your refrigerator. So take this with you and put in anything that is off. So you shouldn't have to put in any doses that were administered. Anything that you're putting in at this point should only be those doses that you've either transferred or wasted or lost and unaccounted for, ones that you're inactivating, expired, things like that. Anything that you actually administered to a patient or that you gave to a patient should have been accounted for on this report, on the doses administered report. So by the time you get down here to the reconciliation page, you should just be putting in ones that you've maybe wasted or ones that you've transferred to other clinics. So again, if anything is highlighted in red, it's expired. So you can zero those out and just put expired for the category and reason, and you can inactivate them. Once you inactivate them, it just takes them off of this page, and they're not in your hair anymore. They're just gone. And then also anything in yellow is within 30 days of expiring, so it's just a nice little alert to go ahead and use those up in the next month. And also, if you do happen to have any doses that you know you administered, you've done your troubleshooting, either they're not coming through to the immunization system or they're getting snagged somewhere, you can use administered but not linked to a vaccine as a reason. This should only be used really sparingly, though, because, again, as we mentioned, as long as you're doing your troubleshooting throughout the month and you're finding all of those throughout the month and you've done your doses administered report, all of those should be accounted for. But this is just one of those rare circumstances where maybe something got snagged on the way to the system or it's just not showing up for some reason. So sparingly, but this is a category and reason that you could use. There's also one reason that you can use that is just simply lost and unaccounted for. So just use the category and reason that most closely matches what actually happened to the dose. You're not going to get in trouble for any, as long as it's not a habit and it's a, long-term, happens over and over again, you're not going to get in trouble, but we do need to know actually what happened to them. So just be honest on these, and nobody's going to jump down your throat if you lose 1 or 2 doses here and there. So also, if you do happen to have more than the system says that you have, you can use order received from VFC program. This should happen rarely. Again, if you've been doing that troubleshooting throughout the month, this probably should not ever happen, very rarely if it does. But if you have more than the system says that you have, you can say that you received it from the VFC program. Unless it's a multi-dose file, and if you counted 10 and you got, hey, I got 11 out of this one, then you can also use that as a reason too. So once you've filled out something, and you do need to put a value in for each and every one of these, you'll want to put in a value for all of these. Any of them that are off, if you're up or down by a couple of numbers, then you'll need to put a category and reason for each one of those. So as long as everything is filled out, then you can just submit your monthly inventory. If you get stopped halfway down or if you get called away, you can press save, and it'll save it, and it won't submit it. So if you do get all the way done with this and you press save, just realize that that will not send it. It won't go anywhere, much like the last report. You can run it and you can look at it, but until you press submit, it doesn't go anywhere. So just be sure that you actually press submit. And once you do that, it will update this date here, the inventory last submitted date, and it will show the date that you click the button, so today's date ideally. And then once you do that, it will be done, and then you're done with it. So at this point, I'm going to pause, and Danette is going to review a couple of review process, just keep you guys up to date on what's going on there and what they're kind of looking for in those reports. And also, we can break for questions either before or after that. So, Danette, it's all yours.
Thanks, Rhonda. Hi, everybody. So I just wanted to briefly review what Spokane Regional Health District is now looking at, because everybody's in this process of changing, and it's all very new for everybody, that even we have had to kind of change how we review reports that come in. So we're still looking at similar information that we always looked at on your hard copy reports that you would mail or fax in. But a couple of additional things we're looking at is we are checking to see that your inventory has been submitted. So we're looking at that date that Rhonda pointed out a few minutes ago. And we're also looking to see that the doses administered date is indicated in there. So when you click submit on your doses administered report, it should put the date in there, and then we can see it. We are still looking at doses administered over age 19, and we can see that on your doses administered report. And then, of course, doses expired. So what it's going to look like in the interim as we transition to online is that please go ahead and jump in and get familiar with this online process and clicking those few extra buttons. Because we have clinics kind of all over the spectrum as far as how they're using the registry right now. Some clinics might be much closer to getting rid of paper than another one. So what we're kind of doing is changing how we look at these reports, and then we will follow up with you each month. And when everything looks great and you're submitting regularly both of the reports, we're getting your temp logs, which still have to come either in the mail or scanned and emailed or faxed. We will call you and let you know that you're good to go. We don't need to receive the paper doses administered report and the lot number summary. So until then, until we've worked it out between us that everything's good, please still submit the paper and then also click those extra couple buttons just until we get the whole process smoothed out. And then once we do, once your clinic is, has the go-ahead to stop submitting your doses administered report and your lot number summary, we still do need to go collect those temp logs and any incident reports for expired doses that you may have or high amounts of waste that you may have. So if you get a phone call from me or if you get an email from me, it's not a huge deal. We're just kind of all working through this process and getting everybody up to speed because there are clinics at various levels. So if you are one of those clinics that have used Excel spreadsheets to do your reports, this might be very new. So if you need additional help, feel free to call me. I try to be available as much as possible for questions, or send me an email if you can't reach me at that moment. So does anybody have any questions?
Danette, this is Julie from Providence Family Medicine Residency.
Hi.
So I just want to clarify. So what you just stated was that each month you still want us to send all of the paperwork with the vaccine administered report and the lot number summary report with our temperature logs, even if we are reporting all online?
Yes, until we have it worked out that we can see everything, because it's very new for us as well. And then I will call your clinic and say, you're good to go, you can stop submitting those two things, but you still do want to submit the temp logs and any supporting documentation, transfer forms, incident reports, and that. But until then, do submit the paper so you can just print it out. You're already in there. You could just print it out and send it along with until we have it all smoothed out and all the kinks worked out. And hopefully by the end of the year, we have most of our providers on board with doing everything online.
Okay.
Okay. Any other questions? Okay. Rhonda, you can take over if you want.
Excellent. Yeah, so thank you for that. And as she mentioned, the paper will be continuing, and then at some point it'll drop off and it'll be just online from there. But we're kind of in this in the middle stage right here, so do both for the time being. And there are, it is a learning process, even for the state. There's the providers, you guys are all learning something new, the LHJs are all learning something new, and then also the state has to figure out how to do this too. So it's a learning experience for everybody. But honestly, I think that it's going fairly smoothly, considering we're rolling everybody out at once. So great job, everybody, and I think it's going to be good to go by the end of the year. So once those two reports are submitted, you can again review that. Down here on the reconciliation page, it should have the date that you last submitted, so you can confirm there that it has been submitted. And then also, you can't order until you've submitted for that month. So once you do go to create your orders, you'll just go here to create orders just as normal. And then whenever you do create your order, just double check here. This might show up in red. If it does, then that means that you have not submitted for this month yet and you will need to. If it's not already doing it already, at some point it will prevent you from ordering. Until you do that, it'll lead you straight back to the reports page. And you won't be able to order unless you submit them. But as long as you've submitted them, you'll be able to see those dates here and you'll be able to make your order at that point. So that's just another double check to make sure that it went through properly. So on to some best practices. Would anybody, should I do a demonstration in the immunization system? Would you like to see this live? It doesn't take too long. and I guess I could find out who has submitted and who has not submitted, and if you guys want me to demonstrate this in the system. How about this? Say aye if you want a demonstration.
Doing a webinar, but we're still in 19, yes?
Say aye if you don't want a demonstration.
Different now. They did something last night to change.
Okay, so I'm hearing nothing, so I'll just go ahead and show you guys. It's really quick, as you can see. So it's here, as I mentioned, the reconciliation page. This is the reconciliation, so you'll just want to print this off, and it will give you that handy worksheet that you can take with you to your fridge. Take this with you, fill in the physical inventory, and then the very next thing that you'll do is go to the doses administered report. So this is the first report that you'll want to fill out.
I can't use that. And that's the code.
And
I just want to use that code, and that's the code for quad.
So if I typed in this,
And just as a quick reminder, if everybody could mute their lines, if you could, that would be very handy because we can hear any background noise that you guys have. So as I mentioned before, if you have already submitted it, you can view those, and it will just give you a pop-up saying, hey, you've already submitted it. But you can view the previous ones that you've submitted here under Create Report. So you can view those. And also, if you want to submit for this month, then you'll just select the reporting month. And I believe I've already submitted for this month as well, so it's not going to let me. But yeah. But as I mentioned before, it will pre-populate the dates in there for you. And you can't go any less than 15 days and no more than 45 days. So you just go in, type in the date range there, and then click Create Report, and it will bring up the report over here. And as I mentioned, this is a test site, so there's virtually no information, but it should fill in all of the doses that you've administered. And then these gray blocks just indicate ones that are outside of the recommended schedule. So it's another thing that you can look out for and just make sure that nothing is in those spaces where they should not be. And then you can submit it here, or you can cancel. And again, if you're just looking at this throughout the month and you don't actually want to submit it at that point, then you can just view it, make sure everything looks good, and then click Cancel. So unless you actually click Submit, it will not submit it. So that's number one. And then the reconciliation page, this is the second report that will that is the same as the lot number summary report. And then you just need to put in something for all of the spaces. Make sure that the physical inventory matches whatever that count was that you just did of your fridge, and try to do it as quickly after you've done your count as possible. That way there's no overlap or people aren't pulling from your vaccine as you're putting the numbers in, because that'll just throw them off immediately. And if there are any changes, then you'll need to select a category and reason for those. So for example, if you wasted one, and lost and unaccounted for, as I mentioned, is a selection. So if you just, quite frankly, cannot find it, it's just gone, then you can put that down there. And once all of these have been filled out, then you can come here. If you do get called away, you can press Save, or you can just submit the monthly inventory. And once you do that, it will update this date with the date that you submitted. And then that vaccine administered report, that previous one that we were on, should also be updated here as well. So it shows the last date that you submitted that to. So those are the two reports. And now we'll just go over some best practices, and then we'll break for questions, and then that is all that I will have for today. So just some general best practices for the clinics. Always receive your inventory within the IIS when your vaccines are delivered. So as soon after they're delivered as possible, because if you don't tell the system that you have that lot number, then whenever you try to use that lot number and attach it to a patient, it's not going to work. So it won't show up on the doses administered report. It's not going to take one out of your inventory, so it throws off all of your reports if it's not there to begin with. So in order for it to be tracked, it has to be present. So just come in, receive your inventory just as normal, and try to do it as quickly after you get it as possible, indefinitely before people start using it. Also, practice good fridge management. Everything goes back to good fridge management, so just be sure that you're using all of your stock effectively, rotating it, using the oldest first, and then you know, keeping as few lot numbers active at any given time. It just all helps out to make the end of the month a lot easier for everybody. And then when possible, complete all of the steps for counting and submitting your reports at one time. So try to do your count and those 2 reports. You can see how quick they are. I just demonstrated them, and it took me about 5 minutes, and that was with explanation. So it's fairly quick. So if you can, just try to complete all of those steps at once. And as long as you've been doing your troubleshooting throughout the month, it should go fairly quickly, and you should be very close, if not right on, with the numbers if you've been taking care of any deviations throughout the month. So that's why it's important to just keep on doing that troubleshooting as you go along, and then by month's end and by reporting time, it's going to be easy peasy. And then keep track of used doses. Try to get a system in place to log wasted or spoiled doses, whether you do it immediately as soon as they happen, or if you do it at the end of the month all at once. Whatever works for you guys, as long as you are putting in the right documentation, so the incident reports are not going away. You will still need to put those in, but whether you log them in the immunization system immediately or you wait till the end of the month, it's fine either way, as long as you actually do it and you don't do it twice. And if you do need a waste log, you can contact Danette, and she can send you one of those as well. And then always select the best category and reason to account for your vaccines, even if it is that you lost it. Again, as long as it's not a habit, it's okay. Just be honest with what you're reporting. And then review the reconciliation page or the create order screen to verify the last submitted date match the date that you submitted your inventory. And if the dates match, then your report was submitted successfully. So again, just look at that date for both of those reports and be sure that it actually went through. And it'll update based on when you press the submit button, not save. You can look at the report all day and you can save it all day long, but it's not going to go anywhere if you do that. So whenever you press submit, that is when it submits. So if you check those dates and they're updated, then it means that you did it right. And then if you have any questions, feel free to ask your LHJ. And then there are some additional training materials that are available. I'll just show you where those are really quick. So on the main immunization system website, under the training tab over here, there are, under inventory and accountability, there are a couple of materials here that you can use. And also, I think that there are some other websites, and Spokane Regional might have some other materials as well. But just ask for materials, and we can give you. There's a lot of them that are available to be used, just in case you need a refresher on the steps. And then if you do need any help, feel free to call somebody from Spokane Regional Health for the childhood vaccine program, and of course the help desk is there as well. So there's lots of avenues that you can take if you do have any questions. We're always here to help you. We want this to be successful, and it's helpful for everybody moving this towards all being online. So, so I'll just break for questions right now. And we'll open up the phone lines, and if anybody has a question, feel free to ask. And if you're shy, you can type it into the chat box too. And we told everybody to mute your line, so in case you are muted, don't forget to unmute it if you have a question.
This is Danette from the Health District. I just wanted to chime in. So you'll see my phone number and email on there. Most of you I think I've met and worked with, but I also added Alexandra. She's our new Immunization Outreach Coordinator, and she is at the 324-1480 phone number that Becky used to have, and then I have her email there too. So if you have questions, she's still kind of learning the ins and outs of the Vaccine for Children program, but she is going to be another great resource that you can contact with questions.
All right. Well, it sounds pretty quiet. It doesn't sound like anybody has any questions, but just in case you think of something after the training today, I would just jot down all of this information here and get a hold of one of us, and we'd be happy to help you.
Thank you, Rhonda. And I just wanted to also remind everybody that if you want to share this with other staff members in your clinic, feel free to access it on our website. It will be posted within a few days on the srhd.org website under the Vaccine for Children program link. We are kind of logging all of our Lunch and Learn sessions on there. So if there's anything you want to review or direct some of your staff to these other trainings, feel free to send them there to view the recordings. And if there aren't any other questions, I think we'll sign off and say have a good day. Thanks, everybody.
Thank you, everybody, for coming.